with Dr. Mathew Epps at his beautiful office here in Bluffton. And before we jump into today's topic, let's talk a little bit about what we're standing in front of, because these are some pretty good credentials here.
These are. Some of these are from just general surgery, others from plastic surgery, and also fellowship in oculoplastic surgery and facial plastic surgery, as well as aesthetic breast and body surgery. And that brings us to today while we're here. We're going to move into our consult room and discuss orbital or eyelid surgery.
Absolutely. Can't wait. So we have now moved into the consultation room, and last time I was here, we talked a little bit about this area of the face and kind of how to make that look like the perfect powder smile again. Today, we're going to talk about this area of the face, and you know, some of us might be a little tired these days, but we can fix that, or we can at least look like we're well rested.
This is one of the most common consults we have in plastic surgery. It's also really underrepresented in overall facial rejuvenation is periorbital surgery or eyelid surgery. One of the biggest bangs for the bucks in plastic surgery is having an upper eyelid excess skin removal or an upper lid blepharoplasty. Another key surgery is a lower lid blepharoplasty. Often what we find is we prolong our aging and youthful look by actually having filler placed in what's called the nasal-jugal groove or up in a tear trough deformity. But that starts to age, and sometimes those fillers can actually make it look worse because the filler...
moving down.
Right.
Okay.
The gravity pull the filler weighs something. Well, filler in this area tends to stay for a very long time, so it almost goes and makes it look worse.
Well, that's not what we want at all.
That's when they come find us, and we explain to them that the surgery is actually a surgery to remove excess skin here, but also fat that's herniating and pushing from the eyeball out and causing that deformity.
Okay.
And that's probably one of the most underrepresented surgeries, as well as lower lid blepharoplasty.
Yeah, you really don't hear about that very often.
What's really key is there's a ligament here that has to be released, but the difference between an upper lid surgery where we're removing that small amount of excess skin is that gravity doesn't fight that. It's actually a fairly straightforward, detailed surgery, but lower lid surgery can be quite complex, although performed routinely almost every day, and having an upper lid and lower lid surgery performed together is very common. But in this instance, the eyeball is pushing down, this lid supports the eyeball, and it's just very, very important to seek guidance or expert opinion from someone who has oculoplastics training, either a 2-year fellowship program through ophthalmology, plastic and reconstructive surgery, or having, in addition to the plastic and reconstructive surgery residency, a fellowship in oculoplastics.
Yeah, because I mean, we're talking about your eye. It's kind of an important part of your body, and you don't want anything to happen to that.
That's exactly what we tell patients too, is that these are your eyes, and it tends to be, you know, relatively straightforward surgery with a few little tricks to it to make sure that this lid is supported appropriately. Otherwise, and you probably see people walk around that have had this surgery, have what we call scleral show, where the white part of the eye shows down here, or they've rounded the eye out. And it's just a few simple things that we can do in the OR that will prevent that.
And one other thing quickly is, you know, sometimes when somebody has their upper done, they all of a sudden kind of look like, oh, I'm surprised all the time. So how do we avoid that?
That is with the precise measurements, and that should be done with calipers. Excellent results in oculoplastics is done with finite measurement. It isn't done with a simple, let's pinch your skin and look at what we can take out, although that is the common technique that most people use.
Interesting.
So if you resect just enough, an appropriate amount, that you can retain a nice almond look to the eye rather than an open, hey, I'm always asking someone a question look.
Exactly. Okay, so what if maybe we're not quite ready for surgery, but we have a little bit of the crepey skin under here? Is there something we can do before we go to surgery?
Yes, and that's what's great about having a consult with a plastic surgeon or oculoplastic surgeon, and even an esthetician or a medical spa experience, is that sometimes you don't need surgery. If it's just kind of crepey, sort of redundant skin, a laser treatment or a series of them, or even a chemical peel, can be very helpful. There are also skincare products that have retinols designed just for around the eye that can help resurface the skin. And that's why it's important to seek expert advice before you proceed down the road of maybe jumping into surgery when you may not need it right now.
Right, and that's one of the things I love about coming here and talking with you. It's always great information, but you always have so many options. So make sure that you are giving them a call if you're ready for a consultation.